Hi, my name is Jesse. I'm a therapist in Milwaukee, Wisconsin, and I'd like to talk today about neurodiversity-affirming care, or neuro-affirming care, and how we can use this approach in therapy. So, the idea of neurodiversity is that there are all different ways of experiencing the world. There's different ways of communication, different communication styles. There's different ways of processing information, different ways of thinking about things. There's different ways of feeling emotions and interacting with others. And there's different ways that we can behave. So just like we all have different cultures, different family backgrounds, different identities, neurodiversity is the same thing. We have different brain types. And whether we have ADHD, autism, dyslexia, or another brain difference, we all deserve to have a good therapist and a good access to mental health care. And so the reason this topic is so important to me goes back to my issue with chronic sinus infections. In fact, I had acute chronic sinus infections for over 10 years, probably more like 15 years. I'd taken all sorts of medications. I even had sinus surgery to try to address the issue. My sinus problems became so debilitating that I had to take naps throughout the day, most days, and it was causing problems at work and in my family life. So, out of desperation, I went to urgent care. I had been to all of these other doctors and couldn't get any answers. The doctor there looked at my history and he said, "You know what? I think you might have ADHD." And eventually, he did put me on a medication for ADHD. And wouldn't you know it, as soon as I started taking this medication, my sinus headaches completely vanished. And I haven't had sinus issues since. Now, since that initial diagnosis of ADHD, I did some reflecting. And yes, I was very stressed because I was trying to fit into some of these roles that were not made for me. And it was causing me a lot of stress. And I was constantly trying to conform. Once I was able to identify that I was a little bit different in some ways and I could kind of ease up on myself and give myself some grace, I was able to function a little better, take care of myself a little more, and my sinus infections didn't come back. The medication also helped. But this got me thinking, and it got me to think back on my life and reevaluate my life, reassess some of the things that had happened that had been hard in my life. And this piece, this ADHD piece, or this neurodiversity brain difference piece, made sense, and it helped me make sense of my history and some of the struggles I've had. So, as a neurodiversity affirming therapist, I really strive to educate myself about some of these different brain differences and differences in how we experience the world. It's really important that I have that foundational knowledge and that I continue to educate myself and seek feedback during the therapy session to better understand ways different people can experience the world. It's also really important that there's choice and control, that the both people in the therapy room need to feel comfortable enough to be sitting together and to working together on healing and recovery. So having control over the environment, the timing, over all aspects of the therapy is really important, that we share that power in the therapy room. Oftentimes it can help us make sense, just like it did for me when I reevaluated my life, that if I walk through life differently with different ideas or different ways of processing things, then I will experience it differently. And other people might not understand me the way that I understand the world, and vice versa. I might not be understanding other people. And so sometimes that can come down to communication skills, other things like that. And those are things that we can practice in therapy. A lot of times, though, it's just really working on acceptance, and that might be self-acceptance. And it might be just kind of understanding that there's a lot of folks, a lot of us out there who have different ways. There's not a lot of normal brains out there. There's a lot of people who are different, and that is okay. I really try to honor and really uphold those differences as strengths and things that we can use as resources. The goal then is to work towards authenticity and acceptance of ourselves and to also access resources that we might need, advocate for ourselves, look at the environment, and if there's accommodations we might need. Those are all things that could come up in the therapy room. And of course, we will also be focusing on mental health issues. A lot of times when we have these differences with our brain, it can cause things like it might contribute to trauma and traumatic experiences, abuse or bullying at a younger age, those kind of things. And some of those things can be processed in trauma therapy. There's also some symptoms of depression, anxiety, and other mental health symptoms that frequently come up with folks who have differences in the way they process information or experience the world. So all of these things are part of the therapy session. Thank you for watching. I hope some of this was beneficial for you. If you have any questions, feel free to reach out to me. You can find my contact information on my website, which is brainspottingonline.org. You can contact me there. You can also subscribe to my YouTube channel. And I appreciate your time today.